is the Emergency Medical Minute.
Welcome to your medical minute of the day. That is not the microphone. This is the microphone. Excellent. All right, so this may have been done already because it's like ridiculously pertinent to our patient population. So this was a study that came out in the American Academy of Neurology in 2017, and it is a study on headache patients. Basically, should we be using Compazine or should we be using Dilaudid? What do you think the answer is? Yeah, so this is a really excellent study. So it's basically was set in 2 emergency departments in New York City. They used an internationally accepted criteria for what a migraine patient is, and then these patients who came in with migraines were randomized to either get Compazine 10 milligrams plus 25 milligrams of Benadryl or 1 milligram of Dilaudid. And then the endpoints that they were measuring was they were looking for, at 2 hours, did they have mild or no headache? And then did they maintain their symptom-free period for at least 48 hours without the need for return to the emergency department or the need for additional rescue medication on top of that? So those are pretty good endpoints, right? We'd be happy if our migraineurs were out of here in 2 hours and not bouncing back within 48 hours. So they had a plan to do a larger study, but most well-designed studies, they kind of stop and check the data at midpoints along the way. And they stopped after 127 patients and found that there was a huge difference. So any guess on the numbers? Difference, like, Compazine's like 100% effective and Dilaudid's like 2%, or how do you think it shook out? So, no? Nothing? 95? Yeah, no, so it wasn't that dramatic, but it was 60% for Compazine were headache-free. And, that kind of makes sense. Not all of our migraine patients are going to get better with just one dose of medication. And 31% were better and sustained better with Dilaudid. So the body that was overseeing the trial actually halted the trial and said, these results are so compelling that we're done. It's too cruel to keep giving people Dilaudid. We should just be giving them Compazine plus Benadryl. The one caveat was that one of the exclusion criteria was that their patients could not have had a narcotic within the last month. So this was not for the opiate-dependent patients. It was for kind of true migraineurs who don't take opiates on a regular basis. But this study would be considered Class 1 evidence, so basically kind of the highest medical evidence that Compazine plus Benadryl is better than Dilaudid as our initial treatment for migraine headaches.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.